So the question came in, what about back to school, Dr. Marble, especially since, you know, there's really the possibility that we may not be going back to school. There's a possibility that at gym class we may have to be wearing masks to gym class. So ever since COVID and the quarantine, this has been an area of concern, especially for our parents. And so what I would tell you is that what we found through our experience is there's been, ever since COVID, there's either been more people being more active or more people being less active. I mean, it's even more polarized than it used to be before. There's more sedentary patients and more active patients. And in those cases, both cases, it usually requires that they be seen by a podiatrist because they either have developed any kind of stress injury, overuse injury because of their activity levels being increased and their body's not used to that, or they have had an increased body mass index. And so with that increased weight that they put on, instead of, I don't know if you know the freshman 15 when they go off to college, a lot of my patients are saying they've got the COVID-19, literally, they gained 19 more pounds, because of the time that was spent on their butts at home. And so what we want to do, the reason why this relates to our patients that are going back to school or not necessarily going back to school, is that as parents, yes, you've got to make sure that your kids are still being active. The beautiful thing about kids is that they are pretty adaptable. If you put together some sort of an exercise regimen with them, not for them, with them, have them talk about the different activities they enjoy doing, and just do them with them. And if they happen to be back to school and they have a regimen put in place by the school system, okay, that's fine. But even better, what an opportunity for you to get out there and be active with your kid. And you can help them be active by putting together an exercise regimen that works best for them. They can actually choose the activities that they are doing. And I would recommend that it involve not doing a lot of this. Those kinds of activities, don't really get your heart rate up as well as if you're out there walking, doing some jogging, even some running, biking, rowing machines, the swimming pools, a lot of them are still open. So just taking obviously appropriate social distancing precautions. And that's definitely an opportunity for you to demonstrate to your child that activity is important. Hope this was helpful, and if you have any questions, please put them in the comments below. We appreciate you subscribing and liking our channel.